This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor. Bring up a case of endometriosis that I saw recently, and it just really points out the problem that we face, patients and physicians face with this diagnosis. This is a young woman who, for the last few years, has had debilitating pain with her periods. And she's been investigated well, or to some extent well, with a colonoscopy because she had some bowel symptoms, with a cystoscopy because she had bladder symptoms, but nobody done a laparoscopy on her. And that's why she came to see me. And we did a laparoscopy. I didn't really know what we were going to find because there's a strange lack of correlation between severity of symptoms of endometriosis and severity of disease. And I always hope that I'm going to be able to make a diagnosis and I can treat it. And that's exactly what happened in this case. We did a laparoscopy. She had a fairly localized area of endometriosis, and the rest of the abdominal cavity was completely clear, except an area behind the uterus, posterior to the uterus, and a place anterior to the uterus. We were able to excise all of the endometriosis there, and I think that she should have a cure at this point. It's a little too early to tell, but I'm very hopeful. And this was the ideal circumstance I see. It's what I want to see when I operate on these patients, that A, make a diagnosis, and B, be able to treat it. And that's what we had. Just raising the awareness of looking for that diagnosis, because there's so much reluctance on the part of primary care physicians and gynecologists to do the test, the only test that we really have to make the diagnosis of endometriosis.
Yeah, and
which is a laparoscopy.
She is going to come on the podcast because she feels very passionately about telling her story. She did end up at the ER and at one point, and the ER doctor accused her of just wanting pain medication.
Yeah.
And she was just in tears. And she did come through as a patient in the middle of the night because she was awake and in excruciating pain. Really sweet patient. I was so relieved to hear that you found the endometriosis, and she was too. She was very emotional and relieved.
She's really felt validated.
Yeah.
If that's the right word.
So more to come on this.
Yep. Thanks.
Thanks. Thanks for listening. And if you have more questions, please let us know, either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.